we all ready?
Yes.
Okay. So the activity that I have prepared for all of you today is basically all about insulin. So the objective is for us to go over the protocol. So that part will be a live demonstration of how to do it. Unfortunately, the projector is not working. They changed the system, so I cannot display it like we were in the classroom. But at least you all have a copy, so we can still go over it, and I'll use the document so it's just a duplicate of the same document, just to make sure you know how to read it. The other activities that I have are different stations afterwards that you're going to utilize to help you understand what insulin is. The station in the back, and I kind of made it on the wall back there or on the door. It tells you to pick a station, and one of the stations is going to be on active listening, which is in your independent chairs. So I'll ask that you all have your cell phones with your earpiece, because I don't want, if you don't have your earpiece, I think you had mentioned on having it, then what you can do is you will maybe listen to it, but then you'll go into a room so you don't disturb your colleagues. So this is one of the private rooms, if that's the activity that you choose to start with, or whatever you decide to do that activity. So at least it won't throw the other people off who are working on like maybe reading assignments or reading exercises. Does that work? So yeah, there's space on the unit. You pick the room. I think the one that the doctors were using, maybe if they're not there, you can utilize that one, or the one I showed you, obviously streaming. So it's going to be basically for you to decide how you want to go about absorbing the information, but I want you to eventually get through all the stations. So some of them might be a little bit more active than others. For example, this one is the protocol. So on station 1, you're actually going to look through the protocol. You don't have to read you're going to skim through it and then make sure you understand the most salient elements when it talks to hypoglycemia. And then I have 2 questions. What would you do? And then you'll answer it on a sheet of paper, explaining what you would do. Okay? The other station over here is station 2, where it talks about what insulin, basically you're learning about insulin in a different manner. There's away from the textbook where it's sometimes quite dense. So I found another format. It's a little bit more simplified. The objective is also to create a graphic organizer for yourself so you can understand what's happening with insulin, what it is glucose, why do we need insulin. And then there's some vocab words, questions in there as well, but it's in a written format. So sometimes it's hard for us to explain things, when you're explaining things to me, or you think you understand a process, but when you go to answer the question, you're having difficulty. So I created that exercise for you as well. The other station is the actual preparation of insulin, which is right over here, next to my desk, so I can make sure that I can keep an eye on you, because you're gonna have syringes in your hand. Whatever activities that you choose, you can work with either independently, because some people like to do things kind of like on their own. Especially, I would say section 3, you can't really listen to the video with somebody. It's you listening because you have your earpiece in. But the other ones, if you want to work in a pair, be my guest. And it's really, I wanted to create this because of what you asked from me. You said you were having difficulty with insulin. Well, let's demystify it. Okay? So we can start with the protocol if you'd like. You can let me know if that's what you want to do. And we'll go through it and make sure we understand how to read it. So the photocopy that I gave you is an actual real live protocol created by a doctor on your left hand side. Okay? On the right side, those are the fake insulins that I made up. The fake millimoles, so glucose that I made up when I went to go and take the patient's sugar. Okay? So I removed the patient identifiers so that you obviously won't know who they really were. And the exercise that I had given you was to basically go through it and make sure that you know how much to give to your patient. So, question, have most of you had the opportunity to work with insulin? Yeah. And how has it been so far?
Well, I've done insulin outside of SASH, but it's very different than what I'm doing here at this one as well.
Okay, and why is that?
Because the paperwork, I'm not used to the paperwork. I don't know. Sliding scale, I don't do that at work, so it's very new to me.
Okay.
And usually when I give insulin, I've never had anybody who's hypoglycemic, so that was my very first time
Yesterday?
dealing with that.
The hypoglycemia? Okay.
So
And you have to rock and roll, huh? Yeah.
That was a lesson.
That was a lesson that you need to just know stuff, and that's why I created that insulin protocol for you. That would be great for you, so you know how to do that. For you.
Yeah, me, I did insulin, but it was the insulin pen,
Okay.
and I find it more convenient, much safer. Because for me, like if you do the manual insulin thing, there's room for medication error.
There can still be room for in both.
For pen, yeah, I would say yes, but that depends on the sliding scale. If you're not reading it properly, then you're gonna be
Same thing.
But also with the pen, normally you expel 2 units, but with the injection, I almost did and I realized you don't do that with the
Right.
injection. Yeah.
Because you're not attaching the syringe after, you're drawing with the syringe, so it's already inside.
My brain couldn't separate that.
But now that you did it, it makes sense.
Yeah.
Okay, so we'll start with the exercise. I'll go through the protocol, and then there's gonna be a station here afterwards where you're gonna actually implement it. Okay? So there's I'm gonna show, is it good? Are you all on the same page? Yeah? Okay, so when we have the protocol, step 1 that I will mention to all of you is that you need to check the patient's what? On each sheet. The name, okay. Well, we need to make sure it's the right person's name, so we check the name. So Miss M, and then we check the patient's good MAR number, perfect. After that, what should we check on the CBGM sheet that we're writing down the insulin? What's the next thing you should check? You can,
Number. Oh.
the what? Patient page number? No. No. I'll tell you, it's the frequency of how often you check the CBGM. So on top of the one I gave you, it says how often are we checking it?
4 times.
4 times a day.
Beautiful. The next thing you want to do is check the date. Obviously, this is something I created in the past, so it doesn't have today's date, but you always go to today's date, okay? So we're pretending like today's date is October the 4th, okay? And we're gonna look at breakfast. So I went in and I took the person's sugar. You all know how to use the CBGM machine, right?
Yeah.
And I got 6.9. The next thing I do is I take that number and I put it into the sliding scale. Oh, I'm glad you're writing notes. Good for you. Good for you. Where's the sliding scale? Do you all know where it's located? I'll show you. Do you know? No? So it's in this section here. So yeah, this is the sliding scale. So maybe you would write on the side sliding scale. They call it correction scale, but it's the sliding scale. Okay? So this for me is section A. I always start with sliding scale. That's A to me. Then, so you can afterwards highlight insulin correction, but you know the sliding scale. The baseline is above it, which is the regular dose that they're always giving the patient, unless the sugar is high or low, then they make decisions based on the sliding scale as well. So this is section B for baseline. How about that?
Which one?
On top?
Okay.
That would be section B. Yeah, that's the baseline. So do you see the words baseline? Do you see it?
Yeah.
Baseline? Perfect.
Yeah.
So then, we're gonna plot that number. So the number we got for the CBGM, I'm gonna have you all plot it into the sliding scale. And tell me, one person raise your hand and let me know where it falls, between what and what. But raise your hand and let me know.
Still on the breakfast, right?
Yeah, on the breakfast, we're on October the 4th. Okay, so yes, Mademoiselle. Crystal?
About 6 units.
It's between what range, is what I'm asking. Yes,
So 6.1 to 10.
6.1 to 10, is everybody there?
Yes.
Perfect. So it's between 6.1 to 10, and then what does it say to do when you take your finger all the way across? It says to,
Give baseline dose as written above.
perfect. Give baseline dose as written above. Does that mean we're gonna use the sliding scale?
No.
Excellent, you said no. So we go straight up. For what time of day is it?
AM.
AM, so stay in the AM column. So which one's the AM column? Point with your finger. Yeah, which for 10? Where's the AM column? Okay, and for you, where's your AM column? Not there yet? Show me the AM column. Is that where you're, so that's the wrong spot. Show, okay, that's the column, but we're giving baseline. Show me the baseline. Okay, perfect. Now you're on the right track. So with your right finger again, put your, beautiful. There we go. And then for you, where are you? Except, now you got it. And for you, do you know where to go? Baseline.
Baseline is this.
So you switched your columns. This is not the baseline, this one is the correction scale, this is the sliding scale.
Okay.
The top part is the,
Baseline.
because here it says baseline.
Okay.
Understand? Are we all on the same page? You want a highlighter? Oh, yeah. You can get a highlighter if you want to. So I'm just gonna make sure she's on the right page. We're all on the right page before I proceed. Okay. You're good? So then afterwards she asked you. So it says, what does it say to do?
Give the baseline those as written above.
So where would that be?
Phase 1.
Is that, can you help her? Oh, because where's the baseline section again?
Here.
Which one is the baseline section and which one is the sliding scale section?
So this is the baseline part.
This is the baseline.
Baseline.
So then this is not the baseline.
Okay, this is here.
So remove baseline from here, and this is sliding scale. Good? Everybody good? Step by step?
Okay. Yes.
Excellent. You got it. We're all on the same page?
Yes.
Or do you need me to go back? We're good? I can proceed? Excellent. So then I'm going to ask for Mademoiselle Sherilyn to tell me what insulin we would be giving. A little louder, I can hear you. Okay, Humalog, how much? So it's not based on this sheet, darling. It's based on the doctor's order. What did the doctor say to give?
6 units.
Of what? And that's it?
Yes.
That's all, okay. Does anybody have a different answer? No?
No.
Perfect. So when I look over here, I'm gonna see if my students are correct.
No.
And I'm gonna say, that is not correct. Why is it not correct? So let me continue. Oh, yeah, you wanna help me?
No, you could continue.
Okay, so the reason why you missed one thing, when you look at the baseline, you look, there's 2 numbers written. There's 1 written, 6 units, and then when you slide your finger across, it says what type of insulin?
Rapid acting.
What kind of insulin?
Humalog.
Okay, so this 6 says, okay, so that's the first insulin you're gonna give, right? Do you see what I'm saying? I'm pointing to you. Perfect. Do you see it as well? The second type of insulin, it says is what?
Lantus.
No, it doesn't say Lantus. It tells you the number first. How much?
14 units.
14 units of?
Lantus.
Oh, okay. You got? You show me? Beautiful. Just want to make sure. Show me. Perfect. Show me. So you start with here, and then you show me the type of insulin. Perfect. And then show me with your pen. 14 of? Show me where the Lantus is. Perfect. So now you've all started step 1, which is learning how to read for the AM dose all the way through. That's just step 1 is finding the right amount to administer. The next thing you would do is you would create a label, right? And you put the patient's name. I'll give this to you after, and then you'll practice. You create the name, and then you'll write down how much insulin you're gonna give. Humalog, 6 units, Lantus, 14 units.
So it's 6 units, but you said that was incorrect.
Because she only had 6. She didn't tell me there was also 14.
We're not done yet.
There was 2 insulins to give. Do you understand why I was incorrect? Because she said to me that's all she was going to give was 6 units. Is that correct?
We're at breakfast. So whatever's written on breakfast, you have to follow that.
It's back. Good. So you understand are you getting what I'm saying? Good. So now I'm going to ask you to, each of you, demonstrate to me. I'll give you the next time. I'll give each of you one, and you're going to show me what you're going to administer for that time of day. Okay? So you can write it on the side or in pen, but for Mademoiselle Crystal, you're going to do October the 5th at midi. You're going to tell me how much insulin you're going to give. Okay? So make a little star there. That's yours. Mademoiselle Jasmine, you will do October the 5th for breakfast.
Okay.
Mademoiselle Sherilyn, please can you do October the 4th for supper. Make a little star so I know that's where I gave you. Yeah, that's for you, a little star. So you figure out how much insulin to get. And then for you, young lady, Miss Balani, you will do October the 6th for supper. And last one will be for you, Mademoiselle Anna. You will do October the 7th for QHS. So I'm going to give you all a moment to figure out the amount of insulin you're supposed to administer, and then write it into your box and then show me where the star is. Okay, that's your star. You done? When you're done, you'll show me. I'll come back around to you to make sure everybody's okay. So let's move your stars here so I don't see your star. Put your star so I know. Okay, that's yours. Perfect. You put a star so I know. Okay, so I'll give you a minute, like a few minutes, right, to work on it. Think through, and then I'll help you if you're stuck.
Miss, did you say put the star on which one?
Put a star on the time of day I gave you.
Okay.
Oh, you're wrote down? Perfect. Okay, so I'll give you a moment. Okay.
It's not right. It's not like, oh.
So you can, I mean, you can collaborate if you're stuck. Just don't spill your water. But if you need help from one of your colleagues, be my guest. Go through, because at least you try to figure out watch out for your water. Okay, good. So you can collaborate and make sure you're okay. So Sherilyn, she might have a different one than you, but she's going to tell you how she did hers. You can work through it together, and then you can show her how you did yours and work together. And if you want me to be your partner, I can be your partner. I will never leave you alone. You're good?
Yeah.
Okay, somebody want to just check to see if Anna's okay? Yeah? Careful here.
Did she posted something?
Yeah, it's for after. Right after.
This one. And some fun 6 minutes.
So it's okay? Like what you felt like it was good?
Yeah.
So we come and see what you got?
Yeah.
Okay, I'm coming. You collaborated, you figured it out. That's it. Okay, so for breakfast you got
Class 6.
okay, so you got the places this is written above.
Yeah. So 0.
We don't look at this one because this is the sliding scale, so we're not even looking here because it says go to baseline, so you go directly. You know, it's like when you're playing Monopoly?
Yeah.
It says go home or something, or you go directly to that section, so it's this section here, and then what you get. Okay, so you're missing something. So when you got 6 units, remember when I gave the example, I showed you this. Oh, why? So, because remember, you go row by row. So I'm going to give you a little trick. When you're doing yours, maybe you need to look at everything in that section. So block everything out beside it, so you can use a key card. And everything here is applicable for
And
you.
the doctor will take it out.
This is these are 2 different insulins. Remember the example I gave you? So the example I gave you, I said 6 units of what? You need to look in the same row. Okay, and then the next one it said 14 units of what? Okay, so on a piece of paper I want you to write down 6 units of Humalog and 14 units of Lantus, and then you're going to tell me. If you don't have, I can make scrap paper. Yeah. I'll give you a little sticky, how about that? So you're gonna write down how much insulin you're gonna give them each. Are you okay? Can you see yours?
So just disregard this part.
Okay, so what'd you get? 6.8, so show me what you did. Okay. Okay. And then, what'd you do? Okay. Right, but when you say zero for lunches, don't even write lunches.
Thank you.
You don't need to have anything here because you're not getting lunches. That's an error. So you erase all this. When it says zero, it means it doesn't exist. So don't even put a zero for lunches on your actual protocol, just leave it blank. Does that make more sense? And for you? Let me just squeeze around you. Sorry. So which time of day did I give you? Okay.
I don't know.
Okay. 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 So what'd you get? What do you have? So you need to write step by step. So I want you to write how much you get for the sliding scale, plus how much you get for the baseline. Ready for me to see?
Yes, please.
1 second, I'll be right there. Yes. Yes. Okay.
So I have 14.5.
Okay.
Based on the sliding scale, so between 14.1 and 16, so I'm going to go all the way at that time.
Mhm.
So that's 2, and then as per the baseline.
2 of what?
2 plus 2 of the human.
Beautiful.
And then since baseline is 0, so I'm just going to give 2 units of human.
Beautiful. You got it.
With that,
They told you, so I don't think I saw yours. So you're gonna write down, so you wrote them out for me, beautiful. So you'll also have to write out which time of day did you have?
Lunch, it was 11.7.
Okay.
11.7 falls over here.
Good.
And it's lunch, so it's plus 2.
Of what? Beautiful. So you have to tell me 0 in the
So
baseline.
there's 0 units of hemoglobin.
No, just 0 unit, there's nothing, it's like the doctor put an X. When there's 0, it's like he's saying don't look there. Okay, so that means you're gonna give how much in total?
So 0 baseline, but 2 hemoglobin.
Okay, so write down your answer here, how much insulin. So what do you have for the units and the amount? Well, you did 6 units of hemoglobin, that's the amount. And then 14 units of lantus. So that's correct now. You see the difference?
Yeah.
Everybody okay? Does anybody else need a sticky for me to see? Let me see, or you're supposed to add them? Yes, this is good. So this is gonna be of what? 5 units of, make sure you put the type of insulin.
But Miss, what would be the answer then?
The answer is 6 units of hemoglobin and 14 units of lantus. For you, is it the same thing? Did you write your little card? Okay, so do you understand that these are two different insulins, right?
So I would put 14 here and then check mark here.
You would put you would correspond the corresponding check mark in the area where the insulin is supposed to be. So you find the type of insulin. Then next to it, in the right column, you're gonna put the amount of units you're gonna give, and then after that, we're gonna prepare it for administration. Okay, are you understanding? I'll give you a moment just to think about that. So make sure you're in the right column. Okay, and then you'll find it. So did you do it? Beautiful. So you don't have to write anything for baseline, you just say hemalog,
Oh,
2
I wrote it
units.
out
For you to understand? Okay, beautiful. That was for me. But is it making more sense?
Yes.
Good? Okay, so now, just as an independent one, so now you you worked on it and then you worked on it in group because I wanted to be first to find the answer. The next one you actually perform, we want to have the opportunity to actually inject it into a patient. So later on, you're going to draw up the insulin. I'm going to give you a patient that has an insulin protocol, so they're going to be diabetic. And then you're going to prepare the insulin based on what we learned in the room today. So I can make sure it's clear. Is there anybody that has any questions? I'll come back to your, what you wrote to make sure you're okay. Anybody else? Yes?
Yes, so we are giving 6 units and 14 units, right?
6 units of hemoglobin. Yep.
14 of lantus.
for this time of day, for the,
What am I supposed to do?
because
For
it's
the
AM.
evening.
Yes, that's correct.
6 is good.
Perfect, so you got it. So the only other thing I'm gonna remind you, so now I see that many of you are on the right track, which is great. So you wanna continue. I'll just mention one other thing. When you write the amount of insulin, obviously that's the time when you're gonna start to prepare it. So you're gonna create your label, and then you're gonna actually draw it up out of the right vial. So you have to pick the right one that says either Lantus for one, and then the other one would be Humalog. For you, Humalog, you understand? Pick the right insulin, do the right checks, and then you draw it up with the right syringe, okay? And I have all the materials so you can clean it. So that will be the next step that we will practice as part, I guess, the part B. Okay, so I'm gonna give you a moment just to process and make sure that you're okay, and then we'll continue. And we don't have to continue with this part B right now. It could be something we continue tomorrow, okay? But at least you know that step one is I really need to understand how much to draw up to be safe. No?
She's me last night.
Okay, she's you last night? Well, then you're gonna try to help your sister today, because we did that last night, right? And after how long? It took us
An hour.
Took us an hour. But then, now is it clear? Thank you. So now I wanna see how much you learned from that experience, and then you're gonna pass on that knowledge to your sister here, and then I'm Jasmine. And then wherever you're stuck, I'm gonna come back to help you. So I know that it's not super simple when the first time around, but once you understand that there's different types of insulin, then you're gonna figure out which ones you can mix, which ones can go in the same syringe. So I think you're stuck in a place where, okay, you're thinking, okay, it's gonna be one syringe, but that's gonna be the second part of your learning. Okay, so we're gonna get into that. Good. So now I'll give you a moment so we can process and do something. The next step. I think it's a good time for you to kind of pick a station in your partners, because for you to either listen to the video for the active listening, like on the door it says. There's a protocol here, which is really great, and I think it's super helpful. Many of your colleagues said that they enjoyed it. And then this is the protocol for kind of what you went through with the hypoglycemia, what to do. So I'm gonna give you a moment just to kind of get up, stretch your legs. Absolutely, but I think this one we'll do something maybe afterwards, okay? Just to make sure. But let's first figure out what is insulin? What does it do in the body? There's a protocol here, how it functions.
Oh, I have to sit here to listen?
Yeah, you'd sit there to listen, and then, yes, like you're facing the wall. Different stations so you can focus, right?
Yeah.
You can work in, so maybe two at each station max. 2 at each station max, I think will be good.
Am I
So-
supposed to keep this?
Yeah, it'll be yours to keep, you can put your name after. So if you wanna work independently, be my guest. If you wanna work with a partner, be my guest.
Hannah, by the way.
I know.
I don't have them.
You guys
You
don't.
don't? Okay, so then you work at this station, no problem. You can bring it tomorrow. We'll continue it. So, just to let you ladies know, for this section here, I posted the video when you go in the classroom, not the next video. I think it's even more interesting.
You just did.
Just now, yeah, just now.
Yeah.
There it is. Go ahead, bring up your earphones. Yes. Okay. Sorry, I mean, I would, because they're going to ask you questions. Everybody okay? If you need my help, I'm here. Again, we can work together. So you can keep your protocol, you write your name on it after. You're gonna keep it, it's your protocol for the hospital. If you need me, I'm here. about hypoglycemia, what happens in the body, things like that. And then after you finish reading about it, then you'll be able to answer these nice questions here. Just two questions. What would you do? Okay? Is that good? Come next to you. Come.
Is with the pancreas, it will produce type 2, it's going to produce us too much.
Type 2, it's that it's having difficulty. So it doesn't produce enough,
Doesn't produce enough
handle the demands.
sufficient.
Yeah, make some notes for yourself. Actually, I'll let you know in here. There's a little graphic organizer for you to take notes. Here, if you want to write notes, things that you learned, or if you have questions, from the back, so you can write on this if you want. But by all means, you can write on this as well, if there's things that you want to understand. But I hope after reading this, you're gonna have a better understanding of what this is.
So my patient is type 1, his pancreas doesn't produce and type 2 doesn't produce enough.
Now you get it? I'm happy. I had a video that I wanted to present to you, but I'll apologize for tomorrow because the projector is not working. So I figured we can start with this format anyway. So reinforce your learning. Good? You're welcome. Let's hear the question.
So long-acting insulin would be like
Sorry?
long-acting insulin, which is glucagon would be, for example, insulin button, reservoir, which is 24 hours.
Oh, good. Yeah, exactly. So I'm gonna bring your document just so you can help you. So when you look at the different types of insulin, which one was the long acting? Oh, you have a cheap, but is this one here? Are you able to see which one's the long acting?
So 1, 2, 3.
There you go. There you go. So maybe it's exactly it. So maybe you write out the people what the names of them are. So you understand next time you see this protocol, those are the long acting. So it works for a certain period of time in the day. Ah, the light bulbs are going off, huh? Or going on, not off, on.
So funny.
Okay, so when you have a word you don't understand, we can just go on Google. Because you have your phone, but my phone is a little bit occupied. So we're gonna pretend like this is my phone. I'm gonna pretend to be you, and then we're gonna look up the wind. What is it? So it's an antibiotic. It's derived from but it's used to treat bacterial infection. How does it treat it? It disrupts the cell wall. Depends on the format. But the whole thing is that you need to know what's happening. Different routes. It can be it's a bacterial infection. So then for you, you would say it is what? So when you have your drug guide, it will tell you what it treats. Like if we're saying bacterial infections, look at the type. Strep throat. It can be an infection. It can be So maybe on here you can write what it is. So let's type of what?
It's anti,
Yeah, anti what?
antibiotic is
Beautiful.
used to cause bacterial infections
How?
by dispatching bacterial
High five. Got it. See, you remember something. So I would, if I were you, maybe make a note here so that you won't forget it. Good job. How's it going, ladies? So we're gonna use these two. You don't have to necessarily use that last page. These ones are the ones that they're gonna explain to you what to do. So page 3, oh, your pages are off. So page 1 is here, page 2 is there. I can staple it for you. And then page 3 there. There we go. So these are the ones that explain to you what to do. How do you treat? And then this is the patient's, if their CPGM is less than 3.9, what do you do? If it's greater than this, in your time they're giving you instructions. Yeah, and then this is what you're giving as the treatment. You understand it? Is it making more sense to you now? Good. Awesome. Keep going, so now you're ready to go. Anesthesia is, clear. And you ask the questions you have to do. Question 1. You're learning now, so I have to ask you, what did you learn in that test? Yes, madam. Yeah. What's your answer? Okay, so what was the antidote? So did it tell you what to do if oh, it didn't tell you what to do? Okay, so then let me ask, what would you do? What the first thing to do is? Right? You're gonna tell yourself. So I like that. You want to tell the doctor right away. But you need to intervene. So what should you do? First thing you need to do is check their right. You need to check the CGM. You need to make sure the patient is complete. You need to tell the doctor. Right? Call the doctor with all the information. It's an emergency. Then they're going to give you instructions. They might, if the sugar is low, well then you would give what? Beautiful. So excellent. So I gave you some glucose tablets here so you can see what they look like. So yeah. That's excellent. Yeah, that's the tablets. You can also give that, but you would give how many tablets? If the sugar was 3, how many tablets would you give? 15? So how many tablets? Is it 4 grams each? Good. So for this one, how many grams is in each? 4 grams each? Okay, so how many tablets would you give? 4 tablets. Yes. And you do exactly what happened to Madame Giselle Crystal. You give it to him, just chew on it. Chew. Oh. So we gave him, on top of it, we had given him juice in a cup with sugar. So we gave him 3 tablets with juice in a cup of sugar. And then what else did you also give the patient? There you go. So we already gave the sugar. We already gave you give one of those selection, right? We had to mix it because we'd already given the juice, so we supplemented it with the tablets. Afterwards, I said, Crystal, we need to give something else, because we need to maintain the sugar. So she gave, like you mentioned, a carbohydrate. So she gave cheese and crackers. Good? So I need and then afterwards, when we checked the sugar, it went to 5 point something. So now we're happy. But how often do you check the sugar? You read? You read? You read? 15. Yes. And then afterwards, you make sure that you note it. So I'll show you that. The next step tomorrow will be how to write it into the document. But at least I want you to finish going through the protocol as a whole layer and make sure that you're okay with it. Okay? Oh yeah, so what would you do? You call the doctor. We did talk about it. We're gonna give them sugar. We're gonna give them something to bring up, depending on what their sugar level is, we need to bring it back up. We were talking about that the whole time. Yes.
So no, they're not any antidote?
That is the antidote. What do you think an antidote is for low sugar? What's the antidote for low sugar?
No, for me, wrong is something.
So the antidote is you need to bring the sugar back up.
Oh.
And then you need to fill out what?
Yes, we have the coincidence.
That's what I wanted you to say. I need to hear you say that the incident report will be filled out. You know, but the emergency is not filling out the incident protocol, I mean the incident report. It's I need to intervene. I need to make sure my patient's okay. That I will fill out the incident. Good. I'll let you guys collaborate a little bit more. Okay.
Yeah.
Yes.
What's that?
Oh, you finished your exercise. Excellent. So then you can, well, you would have joined your sister here because that one's occupied, and then when they're done, they should be done pretty soon. You can flip over. So she was reading and she's answering some questions, and then afterwards, switch up to this.
Thank you.
Put your name on it.
Yeah.
Yep. You okay?
Yeah.
How was the first exercise?
It was good.
Yeah?
Yeah.
Did you learn something?
I did a lot. Yeah.
You're happy? I'm happy.
Thank you.
You're welcome. So, activities are about 15 minutes each. I think it's equivalent 15 minutes each.
Yes.
Questions? And I'm sorry, this is a graphic organizer. We're going to draw pictures. If you need more questions after. So it really makes sure everything you learned today about insulin sticks. Like glue. I think it's been about 15 minutes for you ladies. You want to start another activity? I can bring you. You've learned something? Did you learn something? Yes? This one will continue after. I feel like we need to injecting on our patients. So, I'll put this away. That'll be the next step. How do you feel now, madam, with the knowledge? Yeah, you feel good? Excellent. So we'll talk more about it later. So, oh, you don't have your earphones, so you can't really answer. You can see the board that tells you what stations are here. You can come here. This is the station. Number 1 was reading the protocol. Number two is learning about it through text, through the text. Three is active listening. Four is preparing the insulin in the back, which we'll do tomorrow. There. You don't have your thing? So then you can take the document. Here. You can sit, you don't have to sit, you can sit at your seat. Oh, don't fall. Good, you all, it's okay. You just take your document here. So you can either sit here or you can. So basically, just for the three ladies that got the text now, you're reading the text, and the next page, it has vocabulary words on it, and so just to help you. After that, there are some questions for you to answer. Following that page, we have more questions, self-reflections, and then it's a graphic organizer. So basically, you can write down anything important that you learned, you can draw pictures from your reading, anything to help the information stick. Okay? And if you have any questions, you write your questions in and then I'll help you. Okay? Are you all okay? Yeah?
Yes,
Dear.
this doesn't make sense to me because a study about the insulin is weight gain, but then if you're already weighty to begin with, then you have to adjust the dose of the insulin to match the weight. So like,
I understand, but the problem is that some people with diabetes type 2, that some of their lifestyle is causing that to exercise.
it's a side effect, but then you still.
Exactly. Well, that's the thing, but it's not, it's just something that you should be cautious of, right? But it's, some people, they have no choice, diabetes type 1, you have no choice, you can't take it. So, but for someone that's diabetes type 2, you can control their sugar by doing exercise, proper diet, and if they were to adhere to that, maybe they wouldn't even need. So that's about education, patient education. Good? Good. You're welcome. Okay. Right. Do this part outside. Are things starting to make sense? Yeah? So what I can say is we can take, just for your learning, if you want me to take a little break after you finish reading the text, and then it can be the process of actually like manipulating the syringes. We can do things like that. Just so that you know that there's different ways of grasping the information. So after you finish this, we'll do that. We'll draw up our insulin. Yes, dear.
Like these, I can always answer.
Okay.
Like this one, I can answer. This one, I can answer.
Ooh, so you have to do some research, my dear. Yeah. Maybe go back to the text. You're allowed to go
I
back.
feel like I know it, I just don't know how to write it.
This is what we want to practice, being able to put into words what we're in our mind. You okay? You're allowed to write. notes. Absolutely. Put your name on the document, guys, please.
Get it now?
Get it now? Excellent. Okay. I don't mind you use resources. No problem. You listened. I'm happy. There's progression, my dear. I'm just gonna return some of these items so that we can practice this part tomorrow, okay? Guess I'll stop. Sorry, guys. Okay, so I'm back. What I'll say is I'll give you an opportunity. What we'll do is we'll stop the activity now for this because we'll go on to the next part, and then we'll return to it tomorrow. So that's going to give you an opportunity to finish up those exercises at home, and then you'll bring it in for me. Will that help? Is that fair? Good. So we came to a consensus. So how is the exercise so far for you? Okay? You learned something. What'd you learn?
A lot.
A lot? Okay. For you, Anna?
So I'm still thinking.
You're still
I'm
thinking?
reflecting on what I've
It's
what I
like
learned.
things like already knew, but in a simpler definition that I can actually understand, you know.
Okay, so you like it.
Yeah.
Okay, for you, Anna?
Yeah, so if I understand correctly, for type 1 diabetes, starts when you're age 12 and above, and then type 1 diabetes is when the body is not producing enough insulin, while type 2 diabetes is when the insulin in the body is not like properly functioning.
Right? So if it's not enough.
Yes, not enough.
Fantastic. So you learned something.
Yes, I did. And then the things that you have to do when someone is hypoglycemic, you can give half a cup of soda, not the diet regular soda, or half a cup of juice, or 1 tablespoon of sugar.
So that's where we're going to go to the hospital protocol, because you didn't get to go to the station here, which is the hospital protocol of what you do. But from the video, you learned something. I'm happy. So I hope they interacted. I had the questions inserted in the videos to try to help you stay alert, to help you stay, so that you can actually be thinking during the process rather than just watching a video all the way through. Was that helpful? Yes, for you? We found it helpful? And taking notes as well to make sure that you're okay. I know that tomorrow when we do the stations, when we continue with the stations, and I think it's a good time to work on the other part of our day. At least I'll reset up everything in the right place, but you would already have had your documents. You won't necessarily have to work on the learning about insulin here, but we'll have the drawing up. So I'll maybe have 2 tables for drawing up insulin, and then if there's any other place that you feel like you're stuck, maybe the protocol. I'll have another station for protocol, so we can go back over that. So maybe you can work as a team, kind of like what you went through. So that'll be the beginning part of our day. Is that fair? Okay, good. So I will end that process. Thank you for your participation. Sorry.